Dr. Larry Shults, and I'm a pediatric dentist practicing in Mesa, Arizona. I went to dental school in Colorado at the University of Colorado. I trained at Virginia Commonwealth University in Richmond, Virginia. And I'm now here with my own practice. Well, DentiMax was a new system that I had not heard of prior to coming here to Mesa. A friend of mine who's also a pediatric dentist was using it, and knew somebody who had first-hand experience with it, which piqued my interest. And after looking further at the system, it seemed like a very user-friendly system to use in my office. You know, for me, the big consideration with going with a new company, I was already familiar with Dentrix, and I knew enough that I heavily considered EagleSoft as well, which you mentioned. For me, it was going with a company who was trying to improve and had that as a constant vision, to make it better, to make it easier, to be able to provide help when it was needed. Obviously for me in the clinical side, the charting is very easy to use. I like the quick features that we can put in an entire treatment plan. Chair side, not have to write it down first and then add it into the computer. But the assistants can keep up with me as I go through and diagnose the dental needs of our patients. For me, we try and integrate our front and back office so that it's flowing smoothly, and it integrates very well, where in the back we'll be able to do all of the clinical side. Our charting is extremely easy to use. We're able to post the procedures that were done that day, and the front office, by the time the patient gets up, it knows exactly what was done so that they can both greet the patient knowing what was done and be able to charge the patient correctly at the time of checkout. Our image quality is very good. It's, I've used both conventional phosphor plates and sensors, and the DentiMax sensor is just as high a quality a sensor as any other digital sensor that I've used. I've had a chance to share with other pediatric dentists, hey, how are the kids doing with the sensors? And they do very well with them as far as tolerating them. It helps to have a rounded edge, to have them be thin, and they tend to accept those sensors very well. You know, the sensors are something that are probably something that most pediatric dentists, if they haven't already looked at using, are looking at using. And keeping up with advances in technology, it seemed like it made the most sense. For me, using sensors was partly to help my patients, to reduce exposure to them, but also to improve quality of diagnosis in our practice. So it made a lot of sense for me to start off with a new practice using only the best technology available.